Before we teach Paul how to chart, I will evaluate what he knows about charting and answer any concerns that he has prior to charting. This will allow me to develop a learning center plan based on his concerns and any questions that he has. The first learning objective that I'm going to teach Paul is from the cognitive domain, which will provide him the knowledge base of charting. By the end of the clinical day, Paul should be able to describe the processes of documentation error and late entry. This will allow Paul to reinforce and shape any behaviors used for charting, as well as provide a step-by-step description of how charting should be performed. I've included a PowerPoint or two to help Paul, as well as provide a step-by-step guide for how to document both in the SOAP and DARP format, and also provide any guidelines for him to follow. So to continue, medical charting is learning to do the right way, the when, what, and how to document. The most important charting rule: if it wasn't documented, it wasn't done. The main purpose of charting is to provide a clear, accurate, concise record that records what has happened, what is planned, and what needs to be done. Charting tidbits: use appropriate abbreviations, never document for someone else, only document what you saw and what you did. Never change what you have written, no erasers, correction tape, and do not scratch out and rewrite it. The chart format is SOAP, which is subjective, your patient current condition or chief complaint; objective, finding from your assessment and measurements; assessment, and your plan, what you will do to treat the patient, referrals, treatments, etc. The other charting format is DARP, which is your data, which is your observation of the client; action, which is your appraisal of care plan; response is description of the client responses; and plan is your future treatment actions. It is okay to document later in this day, especially if treatment was completed earlier. If charting day late, after, or late in the day, write late entry and follow through with your document note. I provided descriptions of what to do in this case. If an error, put a line through it and write error and initially afterwards, and continue on with your note. Learning point: I provided you a few chart notes, which you are going to correct the errors using your guidelines, as well as document the appropriate information in either a SOAP or a DARP format. I will be able to tell if Paul follows through with the understanding by evaluating how much of the chart notes he's able to do on his own. The second domain that I'm going to teach Paul is the affective domain. By the end of the clinical day, Paul should be able to briefly discuss what he believes are two document challenges for physiotherapists. He will be able to do this because before lunch I will give him an opportunity to research, as well as discuss with other people from the multidisciplinary team about what they feel is the most challenges while documenting, and Paul and I will have a discussion later in the day about what he has found and what his beliefs are. Also, the third domain that I will teach today is the psychomotor, which allows Paul to demonstrate the ability to successfully critique and rewrite in SOAP format the physical therapy assessment of an assigned patient that he and I have co-treated together. During this time, He will have multiple access to multiple charts. He'll be able to view different chart notes among different disciplines, as well as cope and be able to write a chart note while having multiple distractions in the busy orthopedic unit. To evaluate his psychomotor, I will be able to evaluate this by getting him to have a return demonstration. Therefore, using the C1, do 1, view 1 method. By the end of the day, if Paul has any other questions, I will encourage him to ask these throughout the clinical day and provide any demonstration or review any skills that he has difficulty with. As I know that at healthcare there are many treatment areas and many areas that you can learn from, which kind of makes it hard for a student to learn from all these different areas when there's many distractions. So we will review why charting is important and how to document the different kinds of charting, as well as evaluate any gaps in his learning. And we will follow through by the end of this clinical day, as well as any other clinical days to come.